Okay, now we're going to talk about hepatitis. Hepatitis A, B, and C. As you notice, there's a panel there. We recommend that you get tested.
Right. The first disease is going to be hepatitis A, which is a virus. And actually it's transmitted through usually contaminated water or food, and it also is through the fecal-oral route.
Yeah, so anything shit-borne or poop-borne, anything that's coming out of someone's anus, going into someone else's mouth, is an area where hepatitis A could be transmitted.
Right. They had high instances actually of children who got hepatitis A because they sometimes play with themselves and so forth.
Yeah, and people don't wash their hands sometimes in restaurants, and you hear of an outbreak. Well, that would be hepatitis A.
Right. So some of the signs and symptoms of hepatitis A can be kind of extreme. You can get yellowing of the skin or eyes called jaundice. You can also get kind of a big tummy ache.
And you'll notice that your stomach is bloated and your rib cage, your joints may hurt. You feel extreme fatigue, and your urine or your pee is going to be dark like Coca-Cola, and your poop or fecal matter is going to be yellowy or white.
Right. So the testing that you selected today is going to check you for acute infection for hepatitis A, as well as if prior immunity or vaccination for it.
Exactly.
And if you do come up positive for hepatitis A, we will notify you by phone, and we'll also find out what we need to do next. Typically for hepatitis A, there's not much treatment. It's just palliative measures, taking care of the body aches,
Bed rest.
Getting enough bed
No
rest.
unprotected sex. If you're having a bout, you're going to lay down for about a month, and you'll probably appreciate it because you're going to be a little fatigued.
Right. So you will want to abstain from sex at this point. Okay. Let's talk about hepatitis B now.
Yes.
Hepatitis B is also a virus, but not usually as noticeable as hepatitis A. You're not going to get the kind of symptoms. It is, however, passed differently in that it's passed through blood, contaminated needles.
So if you're sharing needles, and it's even if you're bleaching, you can still pass hepatitis B back and forth. So if you're having any of this high risk behavior.
Right, and also through semen and vaginal fluids. So if you're having unprotected sex, anal, vaginal, oral, you can also get it through those routes as well.
But you can typically tell when someone is infected with hepatitis B because they have a little yellowy bit of the eyes, and they may have some other form of hepatitis going on with that. So That's why we offer the Hep ABC panel.
Right, and so the testing that we do for it is actually going to check for several things. It's going to check whether or not you're a carrier, whether or not you actually have active hepatitis B, or whether or not you've been vaccinated for it in the past as well.
Which is something that's good. In this case, if we call you and tell you that you have previously had an infection of hepatitis B, this is a good thing because it acts as your own body's immunity, so you're not able to get hepatitis B again. So it's like having a vaccination.
Right, so depending on the phone call that you'll get from us, will tell us exactly what we need to do. There are some treatments for hepatitis B, and if you do come up positive for acute hepatitis or for chronic, we will get you some numbers to some people in your area that can help treat you for that.
Now let's move on to hepatitis C, which is also basically a blood-to-blood. And typically, if you're sharing needles, or you've had, needle sharing in the past, if you've had kind of a wild time in your teens, or IV drug user of any sort, or you've had a blood transfusion in a foreign country, or these are all risks, but it's really not a sexually transmitted disease.
Not at all. Not at all. And some of the signs and symptoms, again, mimic that of Hep B and Hep A, just usually not as serious. I mean, sometimes, again, you'll get a little bit of the belly pain.
And the jaundice, and the light-colored poop and dark-colored pee.
Right, and if you do happen to think that you have those symptoms, again, we're going to test actually for an antibody response for hepatitis C. If you do come back positive, again, we'll get you some numbers that you can contact, or you can contact your own local provider in the area that you tested.
Yes, there is treatment available, and we can also take a look at your liver enzymes and make sure that there is some Hep C activity going on there before we refer you to your local physician or county health department.